So your patient says, I'm just not interested. First off, you're going to want to avoid the reaction of, well, why'd you even reach out to us? Avoid that at all costs. Instead, you say, and just so you know, I'm not quite sure we could even help yet. We'd have to understand more about your health history, as well as setting you up for a take-home sleep test, which will give us the absolute best data to understand the current condition of your sleep health, because it may be that you're actually better off sticking with your CPAP, depending on your level of sleep apnea. Are you opposed to having a brief conversation about that? Why wouldn't I say, are you open to having a brief conversation? Why would I say opposed? On a call or text with a lead that's come through your dental sleep marketing funnel, what's the one word that every person has been conditioned to say? It's the word no. So when I say, are you opposed to having a brief conversation? 8 out of 10 times, they're gonna say, no, I'm not opposed. What do you have in mind? You're gonna see that if you say, are you open? You're gonna have far less no's than if you say, are you opposed?